Hi, welcome to this episode of Detroit Peds Talk. I'm Dr. Jamil Smith, lead integrated behavioral health pediatric psychologist at Wayne Pediatrics and clinical assistant professor of pediatrics at Wayne State University. Today I'm here with Dr. Dena Nazer. She's associate professor of pediatrics at Wayne State University. Dr. Nazer is board certified by the American Board of Pediatrics in general pediatrics and child abuse pediatrics. And today she's going to be sharing her knowledge of child abuse and prevention. April is Child Abuse Awareness Month. Although every child deserves a loving and safe home, it's an unfortunate reality. 1 in 7 children will experience some form of abuse. And Wayne Pediatrics is dedicated to lowering these numbers by educating parents and their children on how to prevent abuse. So welcome, Dr. Nazer.
Thank you so much for having me.
So with April being Child Abuse Awareness Month, talk to us a bit about what's the significance of this month.
So I know we all like to think of the whole year being significant for the child, and we like to think of every month as being Child Abuse Prevention Month. But in April, we want to remind everybody that we need to really focus on our children, and we need to work together as a community. So April is when we strengthen the importance of families and communities, and we strengthen the importance of all of us working together so that we can collaborate and provide services for children, and we can protect children, prevent child abuse, and really strengthen the family structures that we have here.
Yeah, it's so important to continue to make this an ongoing conversation and raising that awareness. Talk to us about your expertise in, both general pediatrics and child abuse pediatrics. What does your work look like? What does your role look like?
Foremost, I'm a pediatrician. I'm a pediatrician with Wayne Pediatrics. But because I'm a child abuse pediatrician, most of my work is at Peds Talk Children's Advocacy Center. And that's where I perform all the medical evaluations for children who are suspected of being abused or neglected. And I work with a medical team, which is absolutely fantastic. I work with 2 nurses. I work with Jennifer and Carolyn, and we work within the team. So the whole concept of the Child Advocacy Center is that we offer multidisciplinary help for children who are suspected of being abused and neglected. So we offer them different kinds of services that start off from a forensic interview, assigning every child an advocate, giving therapy, performing forensic interviews, and performing medical evaluations, and connecting children with resources that can help them be in a safe place, and then also at the same time prevent further abuse from happening. So we work with a large team of different professionals, including child protective services workers, including law enforcement, prosecutors, assistant attorney generals. We love our work because we're an integral part of the team, and you can achieve a lot more when you work within a team versus being isolated as just a medical clinic. So that was the whole concept of our clinic being part of the Children's Advocacy Center. And we've been part of them for the past 10 years, and it's just been absolutely amazing.
Yeah, so much of collaborative work going on to support our children. It's just great to hear about. So help us understand, what are some important considerations when we think about child abuse?
I think one of the most important concepts to think about is to think about children and who are children and what are the rights of children. So I feel that we need to change the way that we approach the subject. So instead of thinking of myself, for example, as a child abuse pediatrician and thinking of child abuse and child maltreatment and how children are maltreated, I feel that we think about this differently, in a way of thinking about who a child is. So children are people, they're people who are under age 18. And if we think about every child and how they need to be treated, if we think of our own children, of neighbors, cousins, nephews, nieces, and how when we have children, we want to protect them inside the home, we want to protect them outside the home, and we need to offer them food, shelter, and safety. then once we start thinking of children as rights-bearing individuals, we start thinking of any violation of these rights constitutes child maltreatment. So once we start thinking about the different forms of child maltreatment, including neglect, physical abuse, sexual abuse, we start thinking of them as a violation of these rights versus just purely as child maltreatment concepts.
Yeah, it's sort of seeing that young person and valuing them as a human being, having a lived experience, and appreciating who they are as individuals, and the rights that are a part of that.
Absolutely.
So, according to the National Center for Victims of Crime, 1 in 5 girls and 1 in 20 boys are victims of child sexual abuse. How can we teach our children to be vigilant of predators and be aware?
I think in the back of our mind, we always need to know that the ownership and the support and the prevention of child abuse falls on us as a community and us as adults. So I know that we want to teach our children to be a little bit more vigilant. We need to teach them safety and what's an okay touch versus not an okay touch. But we need to ultimately know that it's our duty to protect our children. And even though we teach children to protect them and to ensure their safety, it really is our role to prevent child abuse towards the end. So I feel that some of the concepts that we could teach children from an early age when they start, for example, taking a little bit of a more leadership role in taking care of themselves, cleaning themselves, body hygiene, using the bathroom, I think it's always important to incorporate safety as we do these day-to-day activities with our children. So, for example, teaching them that it's not okay to be touched at certain body parts. And these body parts are the ones that are covered by the bathing suit, for example. So that's not an okay touch. That's only okay if they're being helped by their parent or by a caregiver, or if they go and see the pediatrician and the pediatrician is doing an exam with their parent being in the room at that same time. So once the children know that concept and know what's an okay touch versus a not okay touch, then they need to know that if they were exposed to a not okay touch, they need to tell someone. Maybe they need to tell 2 people, one who's a family member and someone else who's not a family member. So maybe a school teacher or someone that they know. And once they do tell that person, then it's the ownership and it's really the responsibility of that person to protect them and to make sure that the right authorities are notified. So I feel that this okay versus not okay touch, teaching them personal privacy, personal protection is something that's very important. But it's more important to teach them that if there's anything that makes them feel uncomfortable, whether it's a touch that's not okay, or whether it's something else that's going on at their school or going on at their home, that they need to be able to have someone in their life that they feel comfortable with to let them know about that. And we need to be the comfort zone for our children. And we need to be that open mind and open heart that we're able to listen to them in a non-judgmental fashion. And we need to also be able to keep that line of communication open between us and our children.
Yeah. I like this idea about multiple safe grown-ups being those that children can go to, making that part of the conversation. And then you also talk about embedding some of this okay touch and not okay touch within just daily routine kinds of activities that children are engaged in. It sort of normalizes the conversation, and it allows parents an easy way to think about, how do I bring these topics up and support my child so I build their awareness and their skills. Yeah, that's really
And this is
important.
something that we also bring up during our clinic visits. So usually when the child comes to see us at the clinic, we always stress the importance that this is a medical visit. This is a visit that is meant to make sure that your whole body is perfect, your whole body is normal and healthy. And that does include the private parts. So when parents are there in the room with us, we try to teach them how to talk to their children about that and to let them know that this examination is only okay because I'm a doctor, because you gave me permission, and because your parent is in the room, of course, the non-offending parents in cases of sexual abuse. But we always teach them these things, and we say that if you say no, or if your parent says no, or if I'm not a doctor, then this exam will not be okay. So we stress the importance of that, and we always teach the parents how to talk to their children about what's okay and what's not okay, and in which context something is okay. And that's really a teaching point for us and for parents as well.
Yeah, yeah. Well, how can we as grown-ups or those who care for and care about young people spot a child who may be mistreated or abused?
Sometimes it's really hard to spot children who are abused or neglected. So I always say, have a low index of suspicion. And then sometimes if you feel that something is not right in a child, or there is some sort of injury that you feel may not have been accidental. So for example, let's say that a child who comes in with bruises, a little baby who comes in with bruises, and that baby is not cruising or moving or playing at a playground yet. So they really should not have a bruise anywhere in their body. Then that's when we would suspect physical abuse. Let's say that a child comes in with bruises on their torso, on the ear area, maybe around the neck, in areas that are protected, and these areas are not usually injured as part of accidental injury, then that's when we would suspect physical abuse. But there are also a lot of other behavioral issues that children may present with, and I'm sure you're the expert on that, Dr. Smith. But if children present with depression, maybe they're having a lot of tantrums, maybe they are just not doing well at school, they're expressing themselves differently, maybe they're having a lot of sexualized behavior, maybe aggression towards other people. Maybe they haven't been abused, but that's a child that we really need to be alert to, and that's a child that needs services. So a lot of these behavioral indicators, they may not be diagnostic of sexual abuse or physical abuse, but they are just a red flag telling us that, okay, you need to pay a little bit more attention to this child, and you need to refer that child to other resources in order to be able to help that child.
Yeah, yeah. I think what you're speaking to is just in general being aware of when I often explain behaviors as a way for children to communicate. And so when we see these behaviors that we consider to be problematic or interfering with their daily functioning, it's one way that young people will communicate that I need some additional support. And if you can be looking out for those, as you say, they can be indications that we need other individuals to come into the picture to help them. And so when they come forward, then how can we be supportive of children when they indicate that something has happened along the lines of abuse?
Mhm. I think we need to be very clear that most of the children are physically abused by someone in their family. They're sexually abused by someone that they know. So it's very, very hard for these children to come forward, especially in cases of sexual abuse, when they've been sexually abused by someone within their own family, someone that they trusted, and someone who may be their caregiver at that same time. So I feel that when children come forward, the most important thing is to listen, to be non-judgmental, and to really give them that comfort zone, let them talk and let them express themselves. I think when children come forward, we also need to understand that the whole disclosure and then talking about their experience, it's a long process, and they may not talk about everything at the same time. It's a process that will take time, and sometimes it takes even months and years to talk about their whole experience. And that's completely okay. So don't pressure children to talk. Don't ask them leading questions. Don't be judgmental when they come and talk to you. Just listen, hear what they have to say. And if you have any reason to suspect that there's sexual abuse going on, or physical abuse, or neglect, or some sort of child maltreatment going on, then you really need to be able to call Child Protective Services, and you need to be able to report that, and then let the team deal with all of these other details, and let different team members kind of do and experience their area of expertise when it comes to taking care of children. But as a parent, as a professional, please just listen, be non-judgmental, and let them know that this is a safe zone, that they can talk about things, but also let them know that if they tell you something that threatens their safety, or something that threatens their safety as a child or somebody else's safety, then you really need to report that, so that you don't lose that trust between you and the child.
Yes. Thank you so much for that, Dr. Nazer. And, although child abuse is tragically common, together we can prevent it. I want to thank Dr. Nazer for joining us today and sharing her knowledge about this urgent issue. And if a child is in immediate need, please call. Anyone, including a child who suspects child abuse or neglect, can make a call, make a report by calling 855-444-3911. And that is CPS. That's what you were saying, Dr. Nazer?
Yes.
Okay. So for more information about this topic, please see the comments below. To make an appointment with Wayne Pediatrics, your one-stop pediatrics practice, visit waynepediatrics.org. Also follow us on Instagram and Facebook and YouTube for new Detroit Peds Talk episodes posting every first Wednesday of the month. And remember, pediatricians are the best option for the medical needs of children. Take care.
Thank you so much for having me.